Again, even the way we portray this issue of Kush, not a Kush, anything way bad. If people that they talk about that too much, say, this thing, I say, I know people they try for good, know exactly if not so they happen. So that's the one for experience, waiting really with the talk, if not true. So most times now experimental, then I'm a peer influence.
I think now the conversation is shifting because there's a lot of awareness happening, education happening, but people still think that it is a choice. You understand? People can still think, say, oh, now then choose for do this, now then choose for do that.
Addiction, now brain disease, it affects different areas of the brain. We're responsible for different functions there, for what we do with day-to-day activities there. Like the way we feel, the way we behave, even in terms of the decision making. It affects all the areas of the brain. So addiction, when person don't start, it's not about choice anymore. They are victims now. The best thing, not start them.
Welcome to Honestly Speaking, a podcast where we have honest conversations about the issues shaping our lives. Host Antonia Howard. Today we're talking about the state of mental health in Sierra Leone. Now, if you don't listen to the podcast, you've listened to previous episodes, you go realize that this is a topic or theme that keeps coming up. And that's because our state of mind, essentially our mental health, is really at the center of how we hold ourselves together. It affects how we cope with stress, how we recover from disappointment, how we process grief, how we deal with uncertainty, and just basically how we navigate expectations them from ourselves, with family, society, And when support systems are weak or maybe completely absent, people look for other ways to cope. And for a growing number of young people, unfortunately, a drug that offers a quick escape, but it destroys everything else in the process. So today, we're asking, why is Sierra Leone addicted? And what is the approach to healing? My guest is a leading voice in the response to addiction and mental health in Sierra Leone. He is Dr. Abdul Jalloh. He's a consultant psychiatrist and director of mental health and non-communicable diseases at the Ministry of Health. Welcome to Honestly Speaking. Dr. Jalloh, I think good place for start could be from your own experience. And from what you do at the Kisi home, waiting at the reality the way you see on ground, what are the biggest challenges when it comes to mental health in Sierra Leone?
Yeah, of course, mental health issues not just for Sierra Leone, now a global thing, and the challenges are also not peculiar. And it's just that we're in a low-income country, low resource setting, so their challenges they're profound in our own context. But the challenges the boku, but the major one is stigma. Mm-hmm. Stigma will don't create a huge treatment gap of about 98% people will not get access to mental health care. This has been attributed to several factors there. One, limited human resource in terms of mental health. Currently, I would say now we 5, but from that 5 there, 2 now foreigners there, and with 2 now we work in the hospital. Then one day we 90 head 34. So so now I would say now we 3 basically Sierra Leoneans there currently. Then consider the population of 8-point-something million people. So now you will see say that's a huge challenge. Also, if you consider also in terms of clinical psychologists, we will not get any local clinical psychologist. The one way we get now also a foreigner, we be contracted by the government of Sierra Leone. We attached to the psych hospital. mental health social workers, we don't get none. Occupational therapist, none. The one will be there, in be there on contract, it passed on a few months ago. And even addiction professionals, one of the huge one we get. We not be get, but now we don't train few, but they need to take the exam for me to become internationally certified for medical practice as addiction professionals. So you see that the gap way wide,
Yeah,
even in terms of mental health nurses there.
Yeah, from what you don't explain, it seems like maybe before now, because now at the CC, I'm looking at the conversation, it is deepening, and I think addiction has brought a lot of attention to mental health. But before now, it seems like this was a sector that was being ignored. People, they know not only the resources being allocated by government, but even as, young Sierra Leoneans, even when they were to go medical school, this was not something that people are interested in getting training in. And now it seems, there's a pressing need for professionals in this space. We go able for EPWI, for, cope, basically. EPWI go through what is happening in Sierra Leone right now. But beyond these professionals, beyond healthcare professionals who are trained, what other support systems do you think we need?
Yeah, across the board, starting from even the legal frameworks, the bill, currently the Mental Health Act we use now, the 1902 Lunacy Act, even the name alone, don't you say there's something wrong. Come to the human resource. We need to invest in workforce development. We need also for invest in medical supplies. The medications that we will use, they're very, very expensive. So we need people for support, for come on board. We need also for invest into digital innovation. Even down the back na gap. However, we don't put things in place for address most of the issues that for example, the 1902 Lunacy Act, we get a draft bill currently. We wait in our parliament. Also, we get a mental health policy and plan. Also, we train local psychiatrists there now, locally. Then also, we also train nurses. And for in terms of the other services, we collaborate with partners there for the support way, maybe private and international partners there. So the things we need, they're beaucoup. Yeah.
Let me talk small but addiction now, Kush specifically. Why does it seem pervasive? Why it look like this, they affect so many young people in a salon? And they ask you based on the fact, say, you're a psychiatrist, meaning you have conversations with these people who are substance users, substance abusers, and those who are addicted. And perhaps you've been able to get to the root of how their mind works, we think can lead them down that pathway.
Yeah, the issue of substance abuse now a big public health concern, and also I think currently we're in an international conversation, not only Sierra Leone, because if you go, there is also a big issue of drug abuse. So it's just almost Sierra Leone, the Kush where we see now, not to the Kush where we know. This Kush now locally.
Rehabilitation look like in a salon context where this issue is still stigmatized, even when it's not substance related, even when it's disorders where people then get struggling with their mental health. So what's in the holistic rehabilitation look like now in context na salon?
Yeah, just like I mentioned earlier, due to the gaps that we get, that also they create hindrance to the services where we render. Because for make you get a holistic rehabilitation process, so many things involved. The manpower, the infrastructure-wise, or the facility, the medications there. It evolved a lot, but we dey do our best for render the service there. So, for example, me not a psychologist, but I can do the work of a psychologist because we not get. So we get what we call task shifting and task sharing also. Also, we train nurses there on basic psychosocial interventions there, like how for give psychological first aid, how for render cognitive behavioral therapy, brief intervention. We dey teach there. We dey train them for me able give the service that in service. So holistic rehabilitation. We dey do our best basically, but it's a challenge considering the problem right now we get in the country, this Kush business.
How important is family and community in this healing process? Say someone has gone through the recovery process at Kisi and they come back home, or even people who haven't gone through it, maybe they've just been admitted to the hospital for substance abuse or any other mental health related issue. Waiting at the role of the family or the community where that person they belong to.
A huge, a very huge. Not make so they use the psychosocial model, the social aspect, family, workplace, not only family, but even the workplace, the community also get a role for play. Because the stigma we associated, most people after they don't recover, for me to reintegrate back into the community, a big challenge. Because some families there not even associate themselves to the people that say this person is crazy. And they don't want for me to say they get crazy man na the family. So that's a big challenge also. And that make when they get the psychotherapy, we get what we call family therapy also. Where we call it family also. Because also we too for know is even the family also will become affected indirectly.
In Uswe,
the stigma, the burden of possible mental health condition at the family. One, the cost. Two, for deal with the issues that we surround the person we get mental health issues there, it's huge. So if you themselves get therapy, for me to know, say yes, this is not a sickness, we can affect anybody at any time, then for me to show empathy and compassion to the family members there, or the relatives there, we get mental health issues there. Because without them, that person will continue for relapse. We go 3 times ago, 2 days it come back because the family support not there or the community support not there. And I make we do a massive awareness raising for educating people about mental health issues. See, yes, mental health is real. It affects anybody at any time. Any choose today now for this person, tomorrow it could be you, because in life so many things they happen. Small thing can just switch you.
Yeah. So in this awareness raising, waiting are some key thing the way we need for look at, where we go need for change. Maybe how we approach this issue of mental health. Maybe some attitudes, stigma being one of them, and maybe just the language as well that we use in conversations or in addressing the issue.
Yeah. Now make part of a plan now for engage the media, the fourth estate. Because dependency, or what say that the symptoms or the signs of dependency. You get different stages. First, the one starter say, make I just taste one. That taste you go taste that one day, you go the feeling with that drug did they give that person there. Some will tell you say, doc, what take the Kush or the ecstasy or the tramadol or the alcohol, they make her forget about the daily challenges there for that moment there. So now, anytime whether effect one left you, you go and go for more. And how the dependency now they come in now. So I tell you, if you start with one, if the feeling now reach that peak we want to, you go for more. You go for more. Till some like even get overdose or intoxication. So the dependency they play. But sometimes with dependency also, it can lead to get some mental health issues there. Because substance abuse and mental health conditions there, the worker, each one they lead to another. So people when they're depressed, they can go take substance for calm themselves down. Not knowing say that substance when they take, it cause more depression. So that's why they become so dependent on that substance there. Yeah.
How easy is it to access these drugs or substances? Because I think I'm thinking about it, and the other side of this conversation about Kush is about how it comes into the country, Uda they sell, but Kush is one of the substances being used and abused. There is also tramadol, which I know is often medically prescribed for pain. And there are other, what we would call over-the-counter drugs where people then they abuse. How easy is it to access drugs like that in this environment?
Now it's very easy because there is proliferations of these drugs. Everywhere you go, every community, you get ghettos, you get people where they sell their drugs there. Tramadol, yes, now for pain, but now the dosage where they get, it's more than the one way they prescribe, because they get a dosage when like 5 times or 4 times the dosage level where doctor they prescribe, because one tablet where they take is 225 milligrams. You get someone at 500 milligrams. Whereas the dose where doctor they prescribe not reach that kind of amount there. And for even severe pain there. But now then they take it for different reasons, for sexual pleasure. Some will tell you say not for pain. But the dosage where they take, it's very, very high. Very, very high. And the drug issue currently, it's everywhere. Everywhere. Schools, colleges, workplaces, you name it.
I also think there's a conversation we need to have about alcohol use and abuse. This is because alcohol now also something way widely accessible even to young children, even to children. You see parents then can send them picking them for go buy alcohol. In other places, a child cannot access, you're not able to go inside shop or supermarket or wherever, you're not able to go in a bar and say, oh, then send me, I can buy this alcoholic drink, but not for this person. You have to show your ID. Yeah. Even entrance into recreational spaces, bars, clubs, you need for show ID. But that system there or infrastructure, not in a salon. How does that contribute to what currently obtains in terms of use and abuse of substances?
Yeah, it contributes a lot. In fact, so somebody use the alcohol as the medium for make the ingester. For example, somebody puts the Kush inside the alcohol or the tramadol inside the alcohol or different substance inside the alcohol. Alcohol itself is a psychoactive substance. In back they bug you mind, the way they think, or even your decision making. So imagine I go add alcohol and Kush or tramadol. It double jeopardy. So basically alcohol most times now the most they can start alcohol and cigarettes. And cigarettes. Say a cigarette man they smoke. Now so they graduate into other substances there.
But any regulation currently exists for kind of control access, say for instance alcohol, because maybe it exists, but not the enforcement, maybe there's an enforcement gap. Do we have any regulations that stop, say, children from accessing alcohol within going to alcohol is sold? Because maybe this can be amplified so that people understand better, because me believes the way people they know better, they would do better. But I'm not aware about any regulation like that.
Yeah, we get some legal framework there. We get the alcohol policy. They then also get the Tobacco and Nicotine Control Act of 2022. But I think the issue now the implementation. Now that is a big challenge. The document they hold it, but not the implementation.
So can you state what they say regarding access, especially for children? Are they specify or emphasize children, because this issue don't seep through, it don't go into schools. We see videos on social media of parents really concerned that their children are accessing not only alcohol, but even drugs like tramadol, even the Kush don't go into schools. And if we cannot protect the children, then we have completely failed at this. So within the policy there or laws state about access to alcohol or nicotine, as you said, for children?
Yeah, in fact, the law or the policy that states clearly say nobody for sell that things are to possibly they below 18 years. It did it. Then also they never gets any alcohol or tobacco infrastructure near schools. It didn't they documented. It did a clear one. But if I tell you about what happen, even around the hospital, like you see there, we get ghettos there, we surround the hospital fence. And I did some like kidnap, in fact, they sell the patient inside the hospital. Yes. So you see how the drugs business is very, very serious. The communities back need for help greatly. Because if you get picking, you say this picking under age, you say now for go buy cigarette or alcohol for you. Of course, that picking go experiment for know exactly why this me mama they take her, or why me uncle they take her, or me brother they take her, or me daddy they take her. Instead go know exactly why, how they feel. So now the initial step that they take for me to become addicted to that substance that they.
So whose role you think say school then for play now in this fight? If these policies exist, how can schools use it? Teachers, principals, how can they use it to protect the children?
Yeah, I think so. We go for embark on a very serious community engagement. School outreach for make the people know say they documented that. But I think say Bobako don't know, just like how you self you don't even know say they documented that. So dissemination of the documented that I think a key thing we go for back on, so that people are going to know say we get laws there we govern such activities there. If you do a crime and if they catch you, the law will bet you. Serious one. So I think say we go for make schools especially schools, because everything they start, schools and colleges there, for make we engage them. Now that they make part of we priority initiatives now for school-based mental health interventions there, youth and school, for make them know exactly the dangers of the thing they are, and for also for make we get like youth ambassadors now the schools there for help for raise awareness and sensitize the nation on the things there.
Yeah, and I think that they're really important now before it gets out of hands in schools and places where children are supposed to be safe. Let's talk about the recovery process now. When someone goes to the Kisi hospital, what is the process like? What does that treatment process look like?
Yeah, Kisi now a teaching hospital. So for make the certify say this institution a teaching hospital, it means say it don't tick all the essentials the way it forget for provide evidence-based international care for people that will get mental health conditions there. So we provide a holistic care starting from triage assessment up to reintegration, treatment, rehabilitation, and reintegration, and so many things involved in that. They assess for no waiting wrong with this person here, doing the psychosocial model, okay, family, social issues. Then from there we treat you also, giving medication, counseling or psychotherapy, then social intervention. So that we get a whole unit at the hospital, we call psychosocial unit. After we don't treat the patient there, then now they can help for the social issues and for integrate the patient there into the communities there. So now a whole package, holistic package, where any standard hospital they render, now we serve the render through to recovery.
Yeah, you talk about stigma being one of the challenges, and I wonder what's in holistic rehabilitation look like in a salon context where this issue is still stigmatized, even when it's not substance related, even when it's disorders where people then get struggling with their mental health. So what's in the holistic rehabilitation look like now in own context na salon?
Yeah, just like I mentioned earlier, due to the gaps that we get, that also they create hindrance to the services where we render. Because for make you get a holistic rehabilitation process, so many things involved. The manpower, the infrastructure-wise, or the facility, the medications there. It evolved a lot. But we do our best for render the service there. So, for example, me not a psychologist, but I can do the work of a psychologist because we not get. So we get what we call task shifting and task sharing. Also with the trained nurses there on basic psychosocial interventions there, like how for give psychological first aid, how for render cognitive behavioral therapy, brief intervention with the teach there, we train them for me able give the service that in service. So holistic rehabilitation. It's we do our best basically, but it's a challenge considering the problem right now we get in the country, this Kush business.
How important is family and community in this healing process? Say someone has gone through the rehabilitation process or recovery process at Kisi and they come back home, or even people who haven't gone through it, maybe they've just been admitted to the hospital for substance abuse or any other mental health related issue. Waiting at the role of the family or the community where that person they belong to.
A huge, a very huge. Not that, not make so they use the psychosocial model, the social aspect, family, workplace, not only family, but even the workplace, the community also gets a role for play. Because the stigma we associated, most people, after they recover, for me to reintegrate back into the community, a big challenge. Because some families there, can even associate themselves to the people that say, this person is crazy. And they don't want for me to say, they get crazy man, not the family. So that's a big challenge also. And that make when they get the psychotherapy, we get what to call family therapy also. Where we call it family also. Because also, we too for know is, even the family also will become affected indirectly.
In whose way?
The stigma, the burden of possible mental health condition at the family. One, the cost. Two, for deal with the issues that we surround the person who gets mental health issues there. It's huge. So if it themselves get therapy, for me to know, say yes, this is not a sickness, we can affect anybody at any time, then for me to show empathy and compassion to the family members or the relatives that we get mental health issues. Because without them, that person will continue for relapse. We go 3 times ago, 2 days it come back because the family supports not there or the community supports not there. And we do a massive awareness raising for educating people about mental health issues. See, yes, mental health is real. It affects anybody at any time. Any choose today now for this person, tomorrow it could be you. Because in life, so many things that happen. Small thing can just switch you. Yeah.
Yeah. So in this awareness raising, waiting are some key thing the way we need for look at, where we go need for change. Maybe how we approach this issue of mental health. Maybe some attitudes, stigma being one of them, and maybe just the language as well that we use in conversations or in addressing the issue.
Yeah. Now make part of a plan now for engage the media, the fourth estate, because even the messages they will pass. Because they don't do some studies where you say the message they will pass, it can make things worse. For example, I say suicide. Suicide messages. The way how you pass that message there. One time become I don't know if 2018 or 2020 or so, where some students there go into that rampage of completing suicide because there's a worst result of it. Yes. There was a time because of the messages there where they hear. Again, we get for train the media people for know and for pass on that message. And I make this mental health or substance abuse fight now more important.
I noticed just now you say completing suicide.
Yes, completed suicide.
Rather than commit.
Yes.
Can you explain why?
Because suicide, because we try for decriminalize suicide. Yes. So some countries say suicide is a crime. They forget to say suicide is a mental health issue. So now we change the language from commit suicide to complete suicide. Yeah, because get back, we'll get different steps there. we got what to call the suicidal ideation, suicidal attempt, and completed suicide. Yeah.
You get for explain within that name, suicidal ideation. What does that mean? So that people understand, because maybe people are going through this, but they don't have the language for it. They don't really understand why they're thinking the way they're thinking, and probably what can be done to help or support.
Yeah. With suicide, of course, suicide, we don't mean suicide, a person they may take in life, either intentionally or unintentionally. Then again, suicidal ideation is now the person they think. That's not the extreme stage of depression now, the severe depression. They become worthless, say me and not get any role for playing in a society. Become hopeless. Say I not get hope with life. Now we see most of the boys that go to Kush, maybe not severe depression, because they think say hope not there for themselves, so that they go into Kush. Not knowing say the Kush now more they make the end of life very quickly. So the suicidal ideation, na the mere thinking or the thought about CS, I want to end me life. Then you're gonna have the attempt. The attempts. So the person will tell you say, I not like for talk about suicide, because people say they become tempted sometimes.
It triggers.
It triggers.
It's
Yes,
triggering.
yes, exactly. So you go say so many means how they can attempt. And one thing about suicide, we possibly attempt them once, there is a high likelihood say it continue for attempt until it succeed, until we treat the underlying medical or mental health condition. If not, that person will continue for attempter. Say a completer now.
Dr. Jalloh, you mentioned the media as a key ally in this fight. The media as a tool for raise awareness, spread the messages. But what other sector or group do you see as also a possible ally or a key ally in this fight?
This is not a whole society issue. Everybody important. Everybody can play a role. Communities, the schools, the family, the media, the government, even we, the care providers there. We also get a role for donors, also get a huge role for play. Now, currently, we use what we call the multisectoral approach. We involve everybody, even people with lived experience. They also, in fact, they're at the table in every discussion about mental health. People who get mental health issues or we call it lived experience. Therefore, they're part of every step in every decision where they make on their behalf. Therefore, be part and parcel of it. So everybody important. We use the multisectoral approach. Why I say the media? Because now the interface between we and the community in terms of the messages they want to give, the information. Now that make one a very key ally for make we change the narrative of mental health in the country.
Right. Now with all what is happening now, with the crisis of addiction where we see across the country, is this issue currently being prioritized? I ask based on the conversation that is happening, waiting we they see governments they do. I don't know how much resources are being allocated to the different sectors or elements. You say multisectoral approach. I don't know how much this is being prioritized, but from someone who is on the inside, waiting they go on right now.
Yeah, a lot is going on, and the good thing is this whole conversation don't create a big political will for change the mental health landscape, including substance abuse. Because before, it was severely neglected. But now, with the CCA, the first will not be no budget line for mental health. Now we get, although it's small, very small, very small. So less than 0.1%. But at least now we get a budget line there. And also we get a governance system. Now that make me did it now for lead. And also even for change the laws there. Also that also is ongoing for train people there. So I would say there is political commitment now. But the only challenge now the resources there. We're very difficult for come by. So then again, the other challenge we get now the weak coordination. Now this multisectoral thing what they talk about. Because again, if you get different fragmented offices there for one green, for just one thing, it creates challenge even for donors there for support, because this person go apply for support, go request for support. This other person go request for support for one thing.
The same thing.
Yes. so we see that in a big challenge where we try for sort out, because you can't get different offices there for just one thing. It creates that fragmentation there, and it even confuse the partners there. Who would have to deal with?
Yeah, I can see that. How then do we make mental health care a part of public healthcare, not something that is separate, not something that is, ignored, but a part of public healthcare? We go, I don't want to say central, but I can see mental health care touching on every other aspect of healthcare in Sierra Leone. How do we approach that?
Yeah, so waiting we do now the Ministry of Health currently, we got what to call integration of mental health services into the primary healthcare using the universal health coverage, wherein we integrate mental health into disease-specific programs. For example, malaria program, forget a mental health person or unit. HIV program, we forget mental health. TB, mental health. Child health, we forget mental health. Teenage pregnancy, we forget mental health. Even to the ministries there, MDAs also, we try to forget mental health decks. Now each of their MDAs there, because one integrate mental health. That also will even help we get resources. For get resources and do we activities there. And also now the ministry with treat the patient as a whole person, not in isolation. From pregnancy, during pregnancy to senior citizen, we pursue old. So we integrate mental health in each of their stages that day. Pregnancy, because we able to get better, the hormonal changes they occur. So you get WAMAT, you get a vex, anxiety they come in, up to the time for the even before the better self. We want picking back. It is stress, anxious, depressed. Then at the belly come, the same thing. After we born, or during labor, or we born, they get postnatal depression or psychosis. Sometimes the picking go be affected. Malnutrition they come in. When they make the picking in brain not develop well,
Yeah.
we go affect them in future. So all the stages they come to adolescent, when at the critical age that one day, from adolescent to young adults. Now the most critical age that one the way that most of the mental health issues that they start. So now we integrate all the things along that life stage. Yes. Because for substance abuse, mostly in that age group, adolescents and young people. That they start. Depression, that they start. Anxiety, that they start. Because people at the beginning think, say, well done, I want to become this person. The expectations, they come in. So I make those are the most critical age range from adolescent to young adults. They come out to the older adults now. Now they get a bipolar, there's schizophrenia, there's severe mental health condition. They come in. Then you get out the older adults, there, dementia, because the age, the brain, they become degenerated. Okay, then even isolation, where put your whole family there, then they get in time, then they left farm in one grade and become isolated. So all the issues that they in their lives, but mental health is very important for every stage of a person in life.
Yeah. You make her think about something. When it comes to mental health, I think maybe sometimes we downplay it in this part of the world, in Africa. I talk Dande because you mentioned isolation. Sometimes, we think, okay, in other parts of the world, they have access to many of the basic things that we require. Now, in the way we can talk about every day in our salon, lights, water, you name it, shelter, food, clothing, but still, people have mental health challenges. We can take and say, yeah, we have community, we are less isolated. At least if something they happen, you get people then for talk to, you get paddy them, you have close family members because of how the family unit is set up in these parts of the world in Africa. Some people, their family is extended. You have a lot of homes when are extended family. You get uncle, auntie, cousin them, and that kind of helps people to cope. But what can be the difference then? Is it that the way how we perceive mental health issues na indifferent, or maybe just the state of mind? Waiting the ambogwi from your own professional experience, waiting the ambogwi, we know the ambog people that ubayanda, or maybe there's a common human element where they lead to things like depression, maybe anxiety, from your professional experience.
Yeah, we got to talk about adaptation. If you don't use for the body in a place, also quiet, noise not there, this not there, then you kind of place where very noisy, that they affect you. If you don't use for in a place, also light not there, water not there, you go to a place, also light there, water not there. It is here common. So there's something we call social drift theory. For example, if person within a high class society, then they go live na a low resource area. It affects them mentally. So, like for example, in UK or Western countries, they get the basic things there. They get lights, they get water, this, that. Not to no problem. Those things are our major concerns, and it affects you greatly. But we don't use them because we system does so develop that we were able to adapt to that kind of situation today.
Even though I was born here, Naya don't grow up, will that take a toll on my mental health?
Yeah, of course, because those are basic things. Like for you, yes, because of the kind of work they do, they're the kind of life we want live. Whereas for possibly in the most remote areas, those things are secondary for them, because They need the light, but not as much as you need them. So now you become very anxious, worried, restless, because you want light for do your work. You not get her.
Yeah.
You understand? So I mean, it's all about our wants, about our desires. Yeah.
Yeah. Before we go, what's in your own ideal vision or long-term vision for mental health care in our salon? What do you envision long-term?
Yeah, my vision, basically, I just want make mental health be part of with conversation. Just like how we possibly get hypertension, I get malaria, I get cancer. People, they say, I get typhoid, I get cold. Now that kind of conversation I want. For make mental health be part of a conversation. The stigma for be reduced and make people able to speak out about the mental health issues that they undergo.
Right. Well, thank you so much for your time, Dr. Jalloh. That's the end of this episode of Honestly Speaking. We've been recording at Black Lion Production Studios, and I have been your host. My name is Antonia Howard. Until next time, bye. That's it for today's episode of Honestly Speaking. Thank you for listening and being a part of these important conversations. If you've enjoyed today's discussion, please like and share. And if you're feeling inspired, do leave a review. I'd love to hear what you think. And of course, carry on the conversation online. Share your thoughts, experiences, and ideas using #HonestlySpeakingSL. Until next time, stay curious, stay engaged, and stay honest.